Hi everybody, here is my definition of music therapy. So music therapy is an allied health profession that uses goal-directed musical interventions to address the behavioral, cognitive, developmental, physical, emotional, or spiritual needs of each client. Music therapy is provided by trained and credentialed music therapists to people of all ages and abilities. So the first section I wanted to break down was allied health profession. When I was reading the Bruscia reading, they mentioned this as one of the terms that had been analyzed as all the different definitions, and I had never really heard that definition before. So I looked it up and found a good explanation on the Association of Schools of Allied Health Professions website. So allied health professionals are involved with the delivery of health or related services pertaining to the identification, evaluation, and prevention of disease and disorders, dietary and nutrition services, rehabilitation, and health systems management, among others. I really liked that definition, and it relates to music therapy, because we do fit pretty well into that category. It also includes people like dental hygienists, physical, occupational, and speech therapists, and dietitians, among others. So another reason I wanted to put it as an allied health profession in my definition was it was putting it alongside more well-established professions like physical or speech therapy. I really want it to become more accepted in the eyes of other professionals, and I think by putting it under that allied health profession umbrella, it does elevate it a little bit. So the second section I want to talk about is goal-directed musical interventions. One thing that I've heard that's pretty consistent across different people's definitions is that it is goal-directed in some sense. No matter what population you're working with or what you are trying to achieve, there is always a goal, whether it's the therapist's goal or the client's goal or a joint goal. Always across the board, there's a goal. So I really wanted to make sure I included that. I also like that it's a constantly changing goal, because as people achieve things or regress, the goals are always going to be changing. And then I like the word intervention because I think it implies some level of dialogue between the client and the therapist to achieve those pre-stated goals. But it also implies changing something, because in therapy, you're trying to improve something in your life or change something. So by putting intervention in there, it kind of states that we are trying to improve something. So the next section was addressing needs. So kind of going along with the interventions and the goals, addressing implies that joint relationship between the therapist and the client. Rather than talking about or fixing a problem, it's just addressing something. It's not quite as harsh, and it implies that joint relationship. And then needs, everyone in therapy has needs, otherwise they wouldn't be in therapy. So I did include some areas. I didn't want to have the full comprehensive list that I've seen some places, but I wanted to make sure I included a representative sample of things that therapists can do and work with. So I included behavioral, cognitive, developmental, physical, emotional, and spiritual. So then I chose the word client as my chosen word for beneficiaries of music therapy. I know there were a lot to choose from in the Bruscia reading, and I've heard a lot of different words for clients. Last semester when I was in my geriatric clinical, I asked my supervising therapist what the correct term was for the people we were visiting, and she said it really depended on where we were. If we were in a hospital, it would be a patient. If we were in a nursing home, it would be a resident. But those seemed really specific to that type of population. So in this definition, I wanted to make sure I was covering as much as possible in this short amount of time. So I picked client because I think it does kind of encompass more than just a very specific beneficiary term. I did think it was interesting in the Bruscia reading. He said this: so in some countries and languages, client means customer, so to call a recipient of music therapy a client is inappropriate. Now I understand that customer is kind of a weird word for talking about people with therapy, but it could work in my opinion. So I kind of disagree with his reading there, because people in therapy technically are consumers or customers of that therapy service. They are paying for it, or their insurance company is paying for it. So either way, somebody is paying for those services, which is then they are a customer. I also like the word client because I think of it as they're my boss. If I'm the therapist, my client is my boss. They are paying for my services. So they deserve that level of respect, and I think client to me indicates that level of higher respect than some. And not that the other words wouldn't. Obviously, you respect all of your patients, clients, residents, but again, this is just that more encompassing word, and it sounds like kind of they're my employer, so that's why I chose that one. Then I decided to include both trained and credentialed in my definition of the music therapist. Trained because that to me shows that they have had their education, they have completed all their coursework and clinical experience and all of those things. So they have that experience that's necessary for our profession. But I also want to include credentialed because then it shows that a higher governing body has also decided that they are able and willing and ready to do this profession accurately. So it does put that higher level of trust, I think, in the therapist who is credentialed, rather than just anyone coming in and playing some music. I think it really indicates that higher level of knowledge and abilities. So I really thought it was important to include both of them in this definition. And then my last section here, I included that they serve people of all ages and abilities. And I know this definition is for us in class, but if I were to present this to somebody who wasn't as familiar with the profession, I thought it was important to show that we serve people from prenatal to postmortem and everywhere in between. And it really is an all-encompassing therapy we can work at with anyone with any ability, any age. There really are no restrictions. And I thought that was a nice way to kind of have another umbrella covering all my bases. But that is my definition as it stands right now. I look forward to hearing your comments, and thanks for listening.